Good afternoon, my fellow Papua New Guineans and friends. This afternoon marks day 44 of since the nuclear passing came into effect after the state of emergency. I'm joined here by the Health Minister and our Prime Minister, Honourable James Marape, for this afternoon's press conference. As of today, day 44 of the nuclear passing, what we've had experience throughout the globe, 17,171,005 confirmed cases. Total deaths thus far, 669,242. I remind us all that the declaration of the SOE was 128 days ago. Since then, there's been an increase of 16,798,250 confirmed cases and 653,011 deaths in the last 4 months. In the past 24 hours globally, there was an increase of 284,507 confirmed cases globally. This, let me remind you all, my fellow Papua New Guineans, is the largest or the highest global daily increase since the SOE commenced on the 23rd of March of 2020. Much closer to home, in Indonesia, and in particular Papua province, as of the 29th of July, there's been 3,401 total confirmed cases, of which in the last 24 hours, 42 new confirmed cases. Indonesia has reported 2,381 new confirmed COVID-19 cases in the past 24 hours, again bringing the total number of infections nationwide in Indonesia to 104,432. 74 more people have died of the disease in the last 24 hours in the Republic, bringing the total death toll to 4,975. In the Papua province of Indonesia, they have reported 26 confirmed cases in the last 24 hours, bringing the total confirmed cases to 2,988, and deaths remain at 32. There are 16 confirmed cases in Papua in the past 24 hours. The total confirmed cases have increased to 413, and death toll remains at 5. The cumulative confirmed cases for both Papua provinces now stand at 3,401 confirmed cases and 37 deaths. There was an increase of 42 new confirmed cases, as mentioned earlier, but 0 deaths in the past 24 hours. Why we continue to report on the COVID-19 situation in Indonesia, because it allows us an opportunity to gauge our response, as well as a better understanding of how COVID-19 could grow exponentially in a similar climate as Papua New Guinea. In the past 24 hours in the Western Pacific region, as of 29th of July, 3,729 confirmed cases have been reported from 13 countries or areas in the region. 30 confirmed deaths reported in 7 countries in the region: Australia with 6, Hong Kong 4, Japan 1, Malaysia 1, the Philippines 16, Korea 1, and PNG, unfortunately, we have 1. Since the start of the outbreak, 298,553 confirmed cases in the Western Pacific region, with 8,249 deaths thus far. Australia recorded 278 new cases in the last 24 hours, bringing the total number of cases to 15,582. They have suffered 176 deaths, with 9 in the last 24 hours. New Zealand have had 2 new confirmed cases, 1,559 total cases thus far, and 22 deaths. In Singapore, 334 new cases, which in totaling 51,531 confirmed cases thus far, with 27 deaths. No new deaths for that matter. The Philippines recorded 1,874 new cases in the last 24 hours, bringing their total to 85,486. Total cases, 1,962 deaths thus far, with 16 new deaths in the last 24 hours. All indications are this will not subside in any time sooner in the future. Coming closer to home, in Papua New Guinea, COVID-19 sample collection and PCR testing as of 28th of July. We have tested, and it is a significant milestone for Papua New Guinea, in excess of 10,200 tests thus far. The total number of sample results available from COVID-19 or for COVID-19, 9,626. Out of that 9,626, total number of results negative for COVID-19, 9,552. Number of tests still pending laboratory results are 53. Total number of confirmed cases to date is 72. The total number of active cases of COVID-19 are 54. We have in total 3 critical cases that are currently admitted into our intensive care unit, of which 2 remain critical and 1 is on ventilation. Our total number of deaths still remain at 2. Our research participants in our seroprevalence study, which includes samples from private companies, currently stand at 14,744. So new cases today, case numbers 67 to 72, are all based in NCD, and from the case studies or histories, what it tells us in the National Control Center is that it is very much widespread in the city. Our testing strategies in NCD, in light of the current upsurge in positive cases. Here in the NCC, we're still conducting contact tracing, and that continues, well, it commenced yesterday and it continues today. Morata Clinic commenced testing today. Port Moresby General Cluster is ongoing as we know. 6 Mile Clinic is good to start operating and testing. 9 Mile Clinic will be receiving a tent tomorrow and will be operational. Gordon's Clinic is good to operate. Pari Clinic received a tent today and will be good to operate commencing tomorrow. Koki or Wanigila Clinic will be expecting a tent tomorrow and will begin operations as of 10 tomorrow morning. We expect to mobilize up to 25 Papua New Guinea Defence Force staff to support swabbing at clinics. NCD surveillance team and drive-through clinics supported by St. John's Ambulance will commence or has commenced in the city. Our contact tracing of the situation in Leh, the positive case is now stable and in isolation. 74 staff through contact tracing were identified and are quarantined from the provincial immunization training, which they were all involved in. These include staff from WHO, World Vision, NDOH, and the Morbe Provincial Health Authority. Contact tracing for passengers on PX106 have commenced. 6 gene expert tests of contacts have returned negative. As many of you know, our Prime Minister has reached out on advice from the National Control Center to our partners overseas. And it's been widely reported that Australia, our good friends from Australia were the first ones to respond to our call out to us for assistance. And as such, OSMAT team will be ready to be deployed here on Tuesday, the 4th of August. These include a multidisciplinary team that will assess the need at POMGEN, Rita Flynn, and potential field hospitals around the country, in particular in NCD. These teams include emergency physicians, intensive care specialists, emergency management, laboratory specialists, and these teams are deployed at no cost to the government of Papua New Guinea, and have begun meeting with NCC and POM General Staff as of yesterday. Additional countries have also responded to our Prime Minister's call. This is including but not limited to Germany and New Zealand. My fellow Papua New Guineans, and in particular the residents of Moresby, let me remind us all the need to remain ever so vigilant against COVID-19. This is very trying times for us, and it needs all of us to at least contribute to alleviate the threat that is very much in our midst. With that, I'd like to hand over to the Prime Minister to say a few words. Thank you.
I will not say much, but as the controller has indicated to us, the global trend of COVID-19 is not subsiding, but is increasing. Papua New Guinea, likewise, despite our best of endeavors to try to ensure that we stop it from spreading, since the June recurrence and now the July clusters, we are seeing evidence of community transmission. In February and March advice that we received from our medical experts did indicate that there might be a surge in May, June or July thereabouts. Our surge that was expected early on in the year is now happening in July. But let me give assurance that our government will try our absolute best to ensure that we continue on ramp-up testing and checking those hotspots and those individuals who might have COVID-19 and attend to them in as much as we can. And our endeavors to try to stop it from spreading will not cease, but will be ramped up and increased. As Controller has indicated, we have received a wide range of support from bilateral partners and friends, even further than those closer to home. International Family of Support Network have been mobilized, and if we need extra hands and boots and extra support in this fight against COVID-19, then supports are being mobilized. But first and foremost, our own government mobilizing all our health workers, and I pay my commendation to our health workers, police, our defense, and our frontline people, mending our borders to those who are doing frontline contacts with persons of interest and doing laboratory tests. As we've seen, our own health workers stood very much exposed, and we think of them in these trying times. Our best endeavors to supply and support with PPEs. We've had issues with PPEs in June and, I beg your pardon, in January, February and March. But since April, May, June, up till this point in time, we've been able to stock up supplies, and we've enabled our provincial centers to receive their fair share of PPEs, as well as hotspots like Port Moresby and Lae in Morobe province. But nonetheless, the challenge is here. Let me assure everyone, government will not go to sleep. Amidst many challenges we have, COVID is presently our number one challenge with the effect on the economy, and we are on standby to do our best endeavors to ensure our citizens are not really pushed to the corner, pushed to the limit, but are attended to at the very earliest. And so our support remains. National Control Center is functional. I've had a conversation with governors, impressing on them the need to be sensitive, that this thing is not only Port Moresby based, but could have spread to other areas. Hence, you saw our stopping of general movement in and out of Port Moresby. And in the next 14 days, the intention for us in the next 14 days is really to take stock what has happened or what is happening in Port Moresby in as far as COVID-19 is concerned. As soon as we have a grip on what is happening in Port Moresby, we will readjust. Today I just came back from Lae, an example of trying to function in and amidst COVID-19. The Lae activity was for us to launch 600 million Kenya plus international airport construction. Government will allow development programs to run that will ensure our economy is maintaining some activities. But at the same time, we'll be adjusting to living, working, and conducting business amidst COVID-19 sensitivities, and I appeal to our citizens nationwide. Please bear with us. Your help and my help and our combined help is required in this time of crisis that is induced by a small virus. This small virus is not something that we manufactured. It is something that is now amidst us, and every one of us needs to wear gloves. Every one of us needs to keep a space in between social settings, in between family settings, in between workplaces, and every one of us needs to practice hygiene. And if you feel that you are sick, no need to endanger your family, your community, your neighbors, your workplace, but keep safe. Ring into 1-800-200, and we will try to attend to you. Function of COVID-19 remains into the next few months. In as far as our knowledge is concerned, as control has indicated, there is no known medicine that is found to treat COVID-19. This threat will be around us for some time. And I ask every citizen, please bear with us. We will try to minimize total lockdown, restrictive lockdown, controlling you to the fullest, but we'll give you some space. But when necessary for us to stop in the interest of public safety of all, including individuals, that interventions will be made appropriately as and when it requires. And control has issued clear instructions as to how our country should live and conduct, not only in the next 14 days, but into the future. So I appeal for cooperation, calm as we go through this phase. Your government stands ready to work with each and every one of us through this moment of trial we are going through. Thank you very much. That should be it for today, and hopefully tomorrow we take some press occasions. But today, as our control has indicated, 5 more new cases have been established today. We're working through, and we'll be ramping up more tests. And as we ramp up more tests, there are likely indications that more will be found. And so I ask our citizens to bear with us in this time. It's not something that I'm concocting, something that controller is doing, but something that is really happening in our midst. That's why we are introducing this message for us to live with and abide by. Thank you very much. God bless everyone.